What if that next move that you're going to make is easier because you understand you're not alone? That's what we're going to be talking about today. Welcome to Women Leaders on the Move, a Her C-Suite Radio podcast. I'm your host, Natalie Benamou, and every week I learn right alongside you from incredible leaders and inspirational speakers that share their insights so that we can not only not feel alone, but we can make the next move happen. I'm also the founder of Her C-Suite, a portfolio career network where we help women build what's next. I hope you check it out at hercsuite.com. Today's guest is Dr. Jess Bunin. She spent 23 years running toward moments most people avoid: combat zones, ICUs, difficult conversations. And now she's co-founder of All Levels Leadership. She's a professor and certified executive coach, and we get into details that are really going to shift your mindset. And there are some steps at the end that you aren't going to want to miss. So let's get started now. Dr. Jess Bunin, I'm so excited to welcome you to Women Leaders on the Move. Thanks for being on the show today.
Thanks so much for having me, Natalie.
I cannot wait for this conversation. And I know that our listeners are going to be at the edge of their seats listening to all the things we're going to talk about. So before we dive in, I always like to start with, give us a snapshot of what's bringing us to this moment.
So my passion in life has been developing and taking care of others and developing trusted methods of communication and mentorship to do that. The way I've gotten to that is I spent 23 years as a physician in the Army, developing junior leaders, developing junior physicians, and overall working towards greater and greater communication goals. And over the last 7 years, I've been at the Uniformed Services University, which is the military medical school, and having that opportunity to do that for a huge portion of the folks that are going to come forward as military physicians. But working with them and working with physicians on the outside and now getting greater communication with the public in general, I'm really learning that our communication in healthcare is struggling at so many levels. We're not communicating well to our patients. There's a lot of barriers between students and educators. I think there's barriers between different levels of leadership. And I think there's huge barriers between how healthcare is communicating in general to the public. And it's just got devastating consequences at every single one of those levels, from patients not getting the care they need to physicians experiencing burnout and misalignment, which I think are two very different things, to our greater public not trusting the healthcare system. And it's getting worse and worse as politics finds its way more into the patient care rooms and more into our leadership structures. And so that's my struggle. That's where I'm trying to really step in and help the healthcare system at this point.
Well, first of all, thank you for your service. It's amazing, all the contributions. So you've had a few pivots in your career. I want to talk about that first, and then we're going to dive into the care communication, because that is like my super passion too. So we're going to dive into that. But I know for our listeners who maybe have been in one vertical and think, well, I don't think I can jump over to this next thing. You made a kind of a big change in both medical and now what you're doing. What was that like?
It's been a huge shift, right? The mentality between being a psychiatrist and being a critical care doctor. So I came in to my residency program at Walter Reed as a psychiatry intern. And soon after that, I did a critical care medicine rotation, and I loved it. I loved the relationships with the nurses and the physicians. I loved the team environment of rounding every morning. I loved caring for patients when I could save their life and helping them transition when I couldn't. Everything about it, I was passionate about. So I switched over to a combined internal medicine and psychiatry training program. And my obligation after that, though, was to be an outpatient psychiatrist for 3 years. So I went out and did that. And then after 3 years, came back to specifically do a fellowship in critical care medicine. And it was the most terrifying 6 months of my life. I spent moments all night long worried about who I was going to harm. I would get a call from a resident who would say, oh, I have this case I need to talk about with you. And then I would talk to them and then read about it and talk to my attending and go back into the hospital. And I was worried all the time that I was going to harm people. And then after about 6 months, it just became a joy and everything came together. And so that's was the passion there. But another huge shift for me is in 2019, I went from being a chief of critical care medicine at Tripler Army Medical Center in Hawaii to being a dean of faculty development at the Uniformed Services University, which is in Bethesda, Maryland. And that was a huge shift for me as well, going from a completely clinical mindset to far more of an academic and growth mindset. And then just this year, I've made another complete jump. In December, I left the Uniformed Services University and started writing a book and launched a company. And it's just been a whirlwind of education. And I think, if anything, I am truly a lifelong learner. And so I've had a hugely steep growth curve over the past 6 months, but I've loved every second of it.
When you were describing those moments of being nervous about the decisions, what did you do to offset some of the stress of that?
You have to do something with the anxious energy, I think. And so I did my first triathlon at that point. I did my first marathon at that point in my life. But I also had remarkable friends and colleagues who I could talk to openly and honestly about that pressure and that stress. And so many of them were able to normalize that for me. In fact, my program director at the time said, if you're not worried about killing someone, you need to stop doing critical care medicine because you've lost something important. And it just so stuck with me. Like, it's okay to be fearful as long as I keep learning, keep doing the right thing, keep taking all of the energy and all of the motivation to save lives. The fear is okay.
Moving from that into now you're doing something pretty different than what you've done in the past and writing a book. What has that been like for you in seeing the world in a different way, maybe?
In a completely different way. I walked through the gates of West Point at 18 years old, and I left the Army at 51 years old, left the federal government at 53 years old. Like, my whole adult life was in uniform. So it was a huge shift from government to civilian, but also when you're in a government position, they don't spend time teaching you how to market yourself or how to write a book or how to do these other things that are not specific to your job in the military. We do a lot of focus on leadership training. We do a lot of focus on being better in the role you're in, but not how to build yourself and learn about things outside of that. So in January, I joined a public speaking coaching group that has been phenomenal about building a market, building a position, building a brand, all of these things around how do you build yourself out as a speaker, as an educator, as an entrepreneur. So that's been wonderful. And the education about learning how to write a book and the steps in the process and how to focus has been completely by networking. Networking used to be this phenomenon that was terrifying to me. I thought it's exhausting, it's scary. I had social anxiety about it. And in January, I made this shift to I'm not networking, I'm not trying to take advantage of people. I'm building relationships where I can help them and they can help me, and we can grow and become friends. It changed everything. And the number of people that have been willing to take time and educate me about their process of writing a book, about what it's like to be in publishing, about all of the steps to take after you write the book. All of that, it's just been miraculous how generous people have been.
When I think about networking, there's someone that I had on my show, my number one and my 100th episode, Roz Usheroff. She calls it net giving. And I think when we think about it, and especially with the mindset of you caring for others and offering to be of service, which what is a higher service than serving in the military? It is the highest, I think, and being a physician. So, two out of the two highest roles, thinking about the net giving piece of it. And that sounds a little bit of what you're describing to me of you're giving your expertise, but then you're also on the receiving end, which is so beautiful to hear what others have learned along the way. And then you're able to apply it and share it back, which is one of the best gifts when you do give advice, which I'm sure you know, having been in the roles that you've been in, that when someone says, you know what, I tried it, there's nothing better than you hear that from someone. There been something like that happen?
I am dying to share the story with you. So I have really cared about mentoring. And one of my very close mentees when I was out at Triplet Army Medical Center was a woman who was a civilian. I was military. We were very different in a lot of ways, but we really bonded. And I watched her grow and change and become a leader. And when she graduated, she went to a critical care medicine fellowship and is now a practicing both pulmonologist and intensivist. And we don't see each other as much. She's in Oregon on the West Coast. I'm in Bethesda on the East Coast. We have just got lost in communication. But recently I went to a conference in Oregon and we met for dinner. And she sat down and she said, "Before we say anything, I just need to say this. It's like, I know we don't talk regularly and we're not good about staying up on everything in each other's lives. But every single time I have an end of life conversation and every single time I do a central line, it's your voice in my head." I'm still getting excited just thinking about it. Like, that's what I want in life. I want to create people who are going to be better than me.
I have some of those friendships with people that I've known my whole life or someone that I've known along the way. And those are the best because you don't have to talk to them regularly. But when you do get together, you pick up like it was 5 minutes ago the last time you saw them. You don't have to explain anything. You just are in sync right away. And then to hear that, that must have just been such a wonderful experience. Having those impact moments, that really is what makes life worth living, really, truly.
It makes all of your hard work for years worth everything.
Absolutely, absolutely. And I love the conversation we had right before we got here because we both got so excited about wanting to improve health outcomes. And what I'm doing is health outcomes for women as patients and caregivers. But in the work that you're doing, it's broader but still synergistic. Share a little bit about that because it relates to your book and what you're talking about and the speaking that you're doing. What have you seen and what led you to that?
Well, something I didn't fill you in on earlier is that I'm a survivor of 3 different cancers, most recently breast cancer. So I'm passionate about the work that you're doing, which is so important. And I am a true believer that a lot of women's health issues get swept under the rug or are minimized, or we're told it's just the way it is. And a lot of the research hasn't been done on women's bodies. And so I think that working on that is an essential part of this. But my belief is that we are hurting our patients, we're hurting ourselves, and we're hurting the greater public by not being better communicators. And we spend years learning how to be good doctors, how to get to the right diagnosis, but we don't get a lot of education on how to communicate. And that requires all sorts of steps along the way. It requires understanding yourself and your impact on others and how others experience you so that you can understand how to better communicate. And that requires more than just reflection. That requires others who are willing to point out your blind spots and where you're off and where the gaps are. So that's a huge part of it. Also, learning how to have trusting communication and be willing to be vulnerable in doing that and to have structures to do it across difference. So, one of the frameworks that I teach regularly is called the CLEAR framework for communication, and it is specifically for civil discourse, which I think of as communicating across difference with respect and understanding so that we can move forward and understand each other's perspectives better with a broader lens, not trying to change each other's minds, not trying to win a debate, not walking on eggshells, but specifically working through this clear process just to understand each other better so that we can work more effectively together. And that's my goal. Like, that's really what I want people to start thinking about, learning about. There's so much conflict across difference right now that just doesn't need to exist if we take the time to understand each other.
That point of understanding is actually where we got to with Her HealthX, my nonprofit that I founded. Originally, I was really focused on the problem, which is symptom minimization and dismissal, but it wasn't getting to the heart of, well, I got curious. I have a curious mindset. I'm always trying to learn. And I thought, well, why is this happening? Because you went through all that training. Doctors go through all that training. There's no intention to not want to be a good listener. You've got 9 minutes. you've been trained to listen for keywords. I mean, I'm not trying to put this into your head. That's just what doctors have shared with me, providers. And patients, on the other hand, we have stories. We want to tell that we went to the store, we came back, we noticed this thing, but then I forgot about it. And then I went outside and then I came back. And it's hard to like figure out the breadcrumb because you're like, okay, I think they said this, but I'm not sure what the dot is connecting. And so that's what we're doing. We're creating an AI platform to take those stories and create the output. But I think in the human side of it, understanding that communication is everything. And it really does get to the heart of better outcomes. And for you as a patient 3 times, my goodness, that is a lot to go through. So thank you for sharing that with us. And as a patient on the receiving end, what was some of that experience like for you?
Yeah, it's fascinating to experience it from both directions. So, my cancers, one when I was a medical student, one when I was a resident, and one more recently as a senior physician. And it does change how you view everything when you're looking down as the physician and when you're looking up as the patient, to have both of those perspectives. And for me, what mattered was when there was something that indicated that that person was truly actively listening to me and was engaged, and I had a reason to trust them. And that could be very small things. When I had breast cancer most recently, I was going in for an ultrasound, and the ultrasound tech was doing the work. My surgeon came in to watch and see what was going on. And on her way out, she stopped and held my foot and explained to me everything she just saw and what the next steps were going to be. The fact that she was touching me and making eye contact as she had that conversation with me changed everything about how I perceived her. Like, it just was a different level of contact. It was a different level of active listening. It was a different level of explanation to me. I believed at that moment I could trust her, and she proved to be worthy of that trust. It's very little things that matter. The eye contact matter. As you mentioned, giving patients enough time to tell their story matters. We often interrupt people as physicians in like 11 to 18 seconds. That's not enough for the person in front of you who's the authority on what's going on with them to tell you their story. So, that active listening piece is so important. Giving people the time and then truly connecting with what they say, and then making sure the understanding is there. Because words may mean slightly different things to different people. So, communicating that understanding.
Hey, it's Natalie, and I wanted to pop in and share the nonprofit that I mentioned in this episode, Her Health X. We are bridging the care communication gap for patients and providers and building an AI platform to translate your story into keywords and a narrative for doctors. Check it out at herhealthx.org. Let's get back to this conversation now. And in the work that you did out in the field and you were serving, I would imagine that there was probably intense time frames, especially being critical care. How did that shape sort of your journey on the other side? So we were talking about the patient side, but as a provider, as a physician, you are in those moments of quick decisions. What do you look for? And what is that like as you're trying to communicate that?
Well, there's a couple of layers of that. One of the situations I'd love to tell you about is when I was deployed to Afghanistan, the base I was on was attacked. Several of the planes were blown up. There were missiles blown onto our base, and there were wounded on both sides. We had wounded from the folks who had infiltrated, as well as we had UK and US soldiers that were wounded, soldier sailors that were wounded. And in the ICU, we ended up having both those people, like both of those fronts of people in the ICU in the same bay, very close to each other. And as people came in to visit, there was tensions. But what held us together as an ICU team is that before that event happened, we had really taken the time to get to know each other and develop a psychologically safe environment. So everyone knew that anything that was on their mind, they were safe to say it without any fear of repercussions. So at the time, I was the senior member of the ICU team, but The most junior nurse or respiratory therapist or physical therapist, they could all call me out on anything I said or did if they didn't think it was the right choice. And my job was just to hear them and appreciate it. And so building that team ahead of time is really important, and always thinking about that psychologically safe environment in medicine is huge. But then also understanding what people are afraid of. And we can't know that if we don't ask. And so what we would hear all the time at the time, there was a lot of IEDs. And so folks would end up with amputations. And invariably, men would wake up and say, "Is my junk okay?" And so just being able to understand that that was their question, that was their fear, and to be able to have a conversation about that and either allay their fears or have the right people at the bedside to be able to have that conversation when they were ready to hear it. So knowing someone's fears means asking someone's fears and listening to what they have to say about that. And everyone has different fears. Some people are fearful about, is it going to mean I'm going to have to leave the army? Some people are fearful about what the rehabilitation is going to be like. Some people are fearful about what their future sex life is going to be like. Like, everyone has different worries and fears in that moment. And we have to ask and listen, or we'll never answer the right questions.
What were some of the best moments in that time of where you saw humanity? I can only imagine, especially having two sides be in the same close proximity. Was there a human element or human moment in that? I'm envisioning, I mean, my closest perception is what I've seen in movies and, is not reality. So for our listeners who have served, they can understand, but for those that haven't, what were some of those humanity moments that you're describing? Once you understand the fear, was there a moment that stands with you?
There were many moments. The team that we had, we lived and breathed and ate everything together. And so having those relationships was really key. But the people I was so proud of. I had a respiratory therapist, and his job was anyone who was intubated, like, get them extubated as rapidly as possible and use as little of our supplies as possible to do that. And he would just sit at bedsides and hold people's hands and remind them to cough and remind them to breathe for as long as it took, with just such compassion. Like, I can see his face here years later of how into that he was, no matter who the patient was in front of him. He learned how to say all the words he needed to say in whatever language for the person in front of him, because we were at a base we had Danes, we had Brits, we had folks from various countries in Africa, we had patients who were from Afghanistan. So, like, he would take the time to figure out where they were from, what language they spoke, and how to communicate with them most effectively and calmly. He was remarkable. I had nurses. When I first got there, we had some young children who were either burned or who were wounded. And having nurses sit at the bedside and hold an infant or a toddler for just hours and just rock them and be there with them while other nurses would cover for their other duties so that they could care for that human. I see their faces. I can see them holding and rocking children. Like, all of these little moments are what stick with me. It's the people who do the remarkable things in the name of humanity every day, no matter where you are. And we happen to have been in a combat zone that was recently attacked, but they were humans and they were never going to give that up. And that's remarkable.
I know that you've touched the hearts of everyone listening today. For our listeners, if they want to think about doing something new or overcoming that fear, because a lot of times that's fear, right? The unknown. I don't know what's going to happen. What would you tell her to think about in that moment?
The biggest thing to me is, so many of us feel like we have to go it alone. We're in this by ourselves. And it's just not true. We can't do it by ourselves. And we have to find those people who are trustworthy, but who are also going to be honest and explain things to us with candor and point out our blind spots, and are also going to be safe for us to be vulnerable to, so we can share those fears and they can tell us what's realistic and what's not realistic in those moments, and who understand our goals. It takes time to develop those relationships, but I am over and over again overwhelmed with the number of people who want to help if you just ask. And I don't know that as women, particularly women professionals, we are taught to ask for help. We think we have to look like we know it all. We have to be competent at all times. We can't experience uncertainty or show uncertainty. And in reality, we must. And we must ask for help. And it's never going to make someone look down on you because you don't fully understand a situation or because you need someone's help to do it better. And so that's my big key for everyone is don't be afraid to ask other people for help. They want to help. Another thing I say to leaders, because invariably they say, oh, I love it when people come to me for mentorship, or I love it when people come to me for help. I said, well, then what keeps you from asking? You're depriving people of that joy you felt when they asked you. Why can't you give them that joy back? Right? Like it just seems like the right answer. And we have to reframe that for people because we think we have to know it all, do it all, be it all, or we're going to be looked down on. And it's just not true.
Such good advice. I could talk to you all day. It's so hard to come to this moment, but I have to. If people want to learn more about you, you've got a book coming out. Where's the best place for them to find all the amazing things that you're up to?
So my website is www.jessbuninmd.com. But I would love people to sign up and follow the journey with me. The book will be out in September of this year. The book's in 3 sections. There's a self-awareness section, a trust section, a how do we build better healthcare systems section. So the book is called Self-Awareness and Trust, Leading Physician Teams from the Inside Out. If anyone would like to hear more, I'd love to talk to them. And I'd love to help others now, since I've learned so much about marketing and writing and publishing in the past 6 months. I'd love to share that information so other folks can learn it a little more easily than I did.
Amazing. I will have all of that in the show notes. Thank you so much for being with me today. I really enjoyed our conversation. It's been a pleasure.
Me too, Natalie. Thanks so much.
Thanks for spending your time with me today and Dr. Jess Bunin. I hope if you found this episode helpful, will you share it with a friend or colleague? And it would mean the world to me if you would rate and review the show. It's how others find us. I would be so happy if you reach out to me and let me know what stood out to you in this conversation and maybe a step you're going to take in the advice that we give at the end of the show. For all the people listening around the world, I want you to remember, keep shining your light bright. The world needs you.